Our next speaker is Kylee McGrane Zarnot. She's leading more than a movement. It's the beginning of a more human, more hopeful, and heartfelt approach to care. Her work reimagines what healing looks like, blending the power of play, mental health education, and community care to support children and families when they need it most. She's the founder and executive director of A Moment of Magic, a national nonprofit she started in her college dorm in 2014 with a single hospital visit and a princess dress. What began as one moment of connection has grown into a national network of college student volunteers supporting medically vulnerable children, reaching more than 185,000 children across hundreds of hospitals and community partners nationwide. At A Moment of Magic, the mission is to harness the power of play to bring joy, foster connection, and support mental health healing for chronically ill children and their families. Through this work, Kylee is helping to redefine care, ensuring that even in the most clinical environments, children are not just seen as patients, but as whole people. Her work sits at the intersection of mental health, health equity, and innovation. A speaker, author, and Clinton Global Initiative Fellow, Kylee has been recognized nationally for her work advancing trauma-informed care and expanding access to heart. Kylee is a storyteller, someone who finds inspiration in music, travel, and the small, meaningful moments that connect people to one another. She lives in New York City with her husband and their dog, and brings the same sense of wonder and belief into possibility of everything that she creates. At the heart of her work is the simple belief that even in life's hardest moments, every person deserves to feel joy, dignity, and a little bit of magic. Please help me welcome Kylee and her talk, When a Person Becomes a Patient.
We met by happenstance. She was shy at first, all of 3 years old, and barely tall enough to peek out from behind her mom's legs, just behind the crook of her knee. I knelt down, and for a moment, she just watched me. It took a couple of minutes, but eventually she warmed up. She started to giggle, and soon enough, we were singing together. I twirled her around, and then we were playing. A few minutes later, she wrapped me up in the biggest hug. And just like magic, we had both forgotten that we were in a children's hospital. I was 20 years old, a sophomore in college, when I had this idea and showed up to a children's hospital for the first time, dressed like a princess, which, to be fair, isn't what most people think of when they imagine a children's hospital. But I went because I had this really simple idea, that if kids were in the hospital, maybe we can bring something to them that felt familiar, something that felt joyful or like childhood. I didn't know how much that would matter, but then I met her. For a few moments, everything around us shifted. Conversations about medicine and pokes turned into conversations about fairy tales and sing-alongs. Hospital gowns became princess gowns, and make-believe and friendship became a part of the care plan. Right in front of me, she went from being a patient to just being a kid again. Nothing about her diagnosis had changed, but something about the way she had experienced that moment had. I remember walking out of the hospital that day knowing two things for sure. First, that moment mattered a lot, and second, I needed to go back. So I did, again and again and again. And that's how you accidentally start a nonprofit organization from your dorm room. Over time, that became what is now a Moment of Magic Foundation. That single moment and that single hospital hallway became our organization. I didn't always have the language for that experience that we had, that shift that I felt around that little girl. But I knew I had seen something really important. In that moment, in that hallway, I saw what it looked like when someone was still fully themselves, even though they were in a hospital. And I've spent the last decade trying to figure out how to create more of those moments, because I've also seen the opposite. They say that a moment is an increment of time lasting about 90 seconds. In the medical world, 90 seconds can change everything. When someone receives a cancer diagnosis, they often mark their life in a before and an after, and it often comes down to one singular moment. A lab value that shifts, a scan that lights up, and in that instant, in that one moment, the world changes. That's the moment when a person becomes a patient. A flood of questions comes next, but one refrain rises above the rest. What happens next? What matters next? And the thing is, that moment, that shift, isn't rare. Because according to the National Cancer Institute, there are more than 18 million people currently living with cancer in the United States. And nearly 1 in 3 will be diagnosed in their lifetime. Which means that this moment, this shift in experience, is something that each of us will encounter in our lives, either ourselves personally or through someone we care about. For many of us, there's probably someone we're already thinking about. I want you to really think about them. Take a moment and picture them. The way that they laugh, the way that they show up in your life, the little things that make them who they are. That's the version of someone that we hold on to. That's the version that we don't want to lose. I've spent the last decade sitting on floors and in hallways and at bedside with kids who never asked to become fighters or heroes or medical miracles, trying to understand what cancer does to a person, not just physically, but to who they are. Trying to understand what happens to a person's identity when illness enters their life. Before her cancer diagnosis, Georgia was just 2 years old. She was obsessed with Minnie Mouse and her baby doll Maggie. Before Kylee was diagnosed, she was just starting to come out of her shell. She was finally agreeing to take a dance class, and she was starting to find her confidence on stage. That's one of the things that I was naive to when I first started this work, was how clearly there was a before. But that's certainly one of the things that I definitely noticed right away. The moment cancer enters a person's universe, the language we use to describe them shifts. Their identity can compress. And if we're not careful, their world can shrink to infusion rooms and scan schedules and lab draws. And even with the best of intentions, we can start to see them through the lens of their disease. We can start to see cancer as who they are instead of what they're going through. That's what a diagnosis can steal. Not just health, but personhood. Not just normalcy, but narrative. Because despite how common cancer is, this experience and talking about it and the emotions that come with it is incredibly uncomfortable. And sometimes it can feel awkward and taboo. We've all felt that conversation and that tension in rooms before. Those conversations that once felt easy suddenly require a little bit more thought. We start to say something that we immediately wish that we hadn't, and we start self-editing in real time, and somehow it keeps progressively getting worse. Or we're afraid to say anything, so we say nothing at all. That's what can happen when cancer dictates the relationships around you. It can quietly deepen the isolation. And that isolation doesn't just live in everyday interpersonal relationships. It also shows up in care. According to a study published by the National Institute of Health, 58% of people feel that their emotional needs are less acknowledged than their physical needs during cancer treatment. And that gap between what is treated and what is felt is where so much of this experience lives. And this isn't because healthcare workers don't care. In fact, it's quite the opposite. If you've ever had the opportunity to spend time in these spaces, you know the level of care and commitment that these people and professionals bring into these spaces, oftentimes at great personal cost. Instead, the challenge is structural. Our healthcare system is designed to prioritize what can quickly be measured and coded and treated quickly. Lab values and imaging and protocols fit neatly into that structure. Emotional well-being, identity, and connection don't. But under constant pressure, from staffing shortages to time constraints and financial strain, what's harder to quantify is often what gets under-prioritized, understaffed, and underfunded. But when those needs are sidelined, they don't go away. The person navigating the illness carries it. Which brings us back to the question, when a person is diagnosed with cancer, what matters next? Because this isn't just a healthcare problem, it's a human one. And I've seen what this looks like when we get this right. Not just in theory, but in small, intentional moments that make a difference. Georgia brought Maggie with her everywhere. Every procedure, every appointment. Georgia took her doll with her to every single one. Nurses took Maggie's vitals before they took Georgia's. Maggie had a port just like Georgia did. Her family and her care team made sure that she didn't leave that part behind, that Georgia was still able to be a 2-year-old little girl. She wasn't just a patient moving from room to room. She was still a little girl with a favorite doll and a routine that belonged to her. Maggie was part of how Georgia stayed Georgia. When Kylee was diagnosed with osteosarcoma, she broke her femur, and she was suddenly bedridden. At a moment where she was just starting to come into her own, it felt unbelievably cruel. But music and dance were never taken away from her, because she and the people around her didn't let that happen. A music therapist came to her every single week, and Kylee would sing from her hospital bed. When she couldn't move, Kylee would make her dolls dance, and she and her sisters would film dance videos from her hospital room. Even in the middle of treatment, Kylee and her family and her care team helped preserve that part of her and fiercely protected it. Kylee may have been diagnosed with cancer, but Kylee was still a dancer, and today she's back on stage. I've seen what happens when this part of someone is protected, not just emotionally, but how they move through treatment and how they connect with other people around them and how they keep showing up as themselves. And we're not just imagining that impact, and it's not just magic or fairy tales. When researchers analyzed data from 87 studies, they found that strong social support was associated with a 25% reduction in cancer mortality, which means connection, identity, and support doesn't just change how someone feels, it can actually change outcomes. The way that we create that impact isn't abstract. It shows up in small, everyday choices. First, it's in the language we use, in choosing words that center the person and not the disease. Saying a person living with cancer instead of a cancer patient. Letting someone decide if words like fighter or warrior describe them, rather than assigning an identity that they never asked for. Second, it's in what we ask and what we avoid. And asking, how have you really been doing? And being willing to sit in all of the answers, even if it's uncomfortable. Even if the only answer that they can muster up in that one moment is, I don't know. Or letting them feel the full range of human emotion. It's making sure that we're asking about the person as a whole and not just in regard to their medical treatment. It's resisting the urge to push past discomfort or platitudes or forced optimism. Third, it's whether we preserve autonomy, even in small ways. What to wear, what to ask, when to talk, who to include in updates, how much to share and when. Because when so much is taken away, giving someone some control can make someone feel like themselves again. And finally, it's in the decision to stay. Whether we continue to text, to call, to show up. Even if the answer is no, even if there's no answer at all. Whether we let someone laugh or cry or complain, and being willing to sit in uncertainty and silence, even when we don't know what to say, which, to be honest, is most of the time. It's simply saying, I care about you, I'm thinking about you, I'm here for you. These small human choices are what shape what matters next. They decide whether cancer or illness is an isolating experience or one stitched together by community. None of this requires a medical degree, which is great because I don't have one. But it does require humility, attention, presence, and the willingness to see someone as more than what's happening to them. As both diagnosis and survival rates continue to increase, what matters next extends beyond whether people survive. It asks how they live. I think back to this moment often, about this little girl who had the entire hospital stop to watch her, with her singing and her laughter and her joy, which, to be honest, is not what most people think about when they think of a children's hospital. But in that moment, she showed us all that even in that hospital, something else can exist alongside it. Something joyful, something light, something deeply human. It wasn't just a little girl and a volunteer in a princess dress. It was a little girl and her new friend in a moment where she wasn't defined by a diagnosis. It was where she was the main character of her own story. Nothing about her diagnosis had changed, but something about how she experienced that moment did. She reminded us all what was possible. And when we start to see what's possible, we begin to create more of it. A doll, a dance, a little moment of make-believe, tiny acts of honoring who someone is. This is how a patient becomes a person again, not through one grand act, but through a million little moments. Thank you.